Sickle cell disease is a chronic disease. It's a lifelong disease, punctuated by episodes of vaso-occlusive crisis, which result in pain. But beyond the pain, the underlying pathology is the occlusion of the microvasculature, which results in ischemia and secondarily organ damage.
There are a dearth of available therapies today. The standard of care is mostly just hydration and pain medication. There's unmet needs, particularly around the organ damage.
The organs are damaged because each of these episodes causes what we call tissue ischemia. When there's a vaso-occlusive crisis and there's obstruction of blood flow, the tissues that are supplied by those blood vessels no longer have oxygen, and so some of them die. It's almost like having a heart attack anywhere in your body at any time.
When you have a heart attack, that's ischemia to your heart organ, and a little piece of your heart organ dies. Sickle cell disease is no different, except now you're not talking about a heart attack, you're talking about a leg attack, or a brain attack, or a kidney attack, or a lung attack when you have a vaso-occlusive crisis.
There are a number of companies that are trying to develop therapeutics that will affect different aspects of the disease. I am extremely happy that there's a phase 3 trial now of a treatment that could shorten the duration of sickle cell pain crises.
With MST-188, we're trying to get to the root cause of the disease, to preserve some organ function, to reduce the ischemia so that that pain that's exhibited will be reduced.
This drug holds the promise for me as a physician to have the potential to offer an alternative treatment that could potentially not only decrease the duration of crisis, but decrease the duration of ischemia because the drug improves microvascular blood flow, and so consequently decreased organ damage, which potentially could translate into improved longevity.
They have on the horizon very soon, hopefully a therapeutic that will shorten the pain crisis gives a lot of hope.
At this point, for some people, sickle cell disease feels like a death sentence, but it doesn't have to be. And I think the drugs that we are coming up with now are going to turn it into a disease that you go, oh, I have sickle cell disease. That would be wonderful.